All right, thank you so very much for the opportunity to present this information today. And like Dr. Abbott and Dr. Lansky, who presented before me, I think we're all very excited about the level of interest and kind of really getting into these questions about if our female and male patients differ from each other. So this is a sex-specific OCT characterization of intravascular lithotripsy for treatment of calcified coronary lesions. Here are my disclosures. So this was a pooled analysis study design where patients that were enrolled in CAD 1 through 4 were included in this study, and specifically we were looking at a sub-study analysis of individuals that underwent OCT at the institutions that regularly were performing OCT measurements. The OCT core lab was sort of reviewed all of the OCT images for calcium morphology to evaluate visible calcium fracture and post-stent findings. And then also the angiography safety and effectiveness was evaluated. So this is just a sort of an overview of the patients that were included. Overall, we had 262 patients included in the OCT analysis. The core lab was at CRF in New York, and the target lesions were severely calcified adenoid lesions, and the reference vessel diameter was between 2.5 and 4 millimeters. So on average, similar to Dr. Lansky's cohort of patients, the women were older than the men, in this case by approximately 5 years, so significantly older, but otherwise their baseline characteristics were similar between the men in terms of hypertension, hyperlipidemia, diabetes, prior MI, bypass surgery, and renal insufficiency. In general, most of the women and men both underwent LAD PCI, followed by right coronary. And in general, women did have a smaller reference diameter compared to men, which isn't that surprising. Otherwise, the characteristics between the calcification were similar. It's, again, I just wanted to emphasize that we're talking about very complex calcified coronary lesions. These calcified lengths of, when you think about it, 40 millimeters of calcification length, with many of them being bifurcation lesions. These are very complex subsets. So as far as the procedural characteristics, there were no significant differences between men and women in terms of the overall procedure time or any issues related to delivery. Those were all 100%. The lithotripsy balloons were delivered. The number of catheters were similar between men and women. And you can see that the maximum pressure and balloon to artery ratio were similar. Here are just some very nice examples of some OCT images. The one on the left representing the pre-procedural calcification. As you can see, it's really essentially concentric with very thick calcium. And then the post-intravascular lithotripsy image demonstrating some very obvious fractures, which is it's great to see and confirms that you've modified the calcium, and then a really excellent lumen area after stenting. So I think that this is some of the most interesting, one of the more interesting parts of this particular study, and that's looking at, what are the actual characteristics of the calcium that women have. It's fascinating to me that, women do have, again, on average, a smaller minimum lumen area, again, that goes along with the smaller vessel size, but that their calcium angles and thickness were similar to men, and they were just as likely to have calcified nodules, and that the overall maximum continuous calcium angle was similar between men and women. In general, they had a similar response to lithotripsy with a similar number of visible calcium fractures, as well as the fracture depth and width. Post-stenting, the OCT measurements were really favorable for both men and women, in that they all had sort of an increase in their luminal area. But again, because women started off with a smaller vessel size, they still had a smaller lumen area following PCI. Again, that sort of goes along with what we know about women and their anatomy. And the mean stented area was smaller for the same reasons. But the stent expansion overall was similar between groups, essentially representing that women had a very excellent response to lithotripsy, similar to the men. As far as the final angiographic outcomes, we found that women, similar to men, had an excellent post-stent diameter stenosis, which is greatly improved from baseline, and that they had essentially across the board no complications both in men and in women, which is really reassuring, especially framed in reference to what we know from prior atherectomy trials. So in conclusion, this present individual patient pooled data analysis is the largest analysis of sex-based OCT findings following lithotripsy treatment, and overall calcium morphology and visible calcium fracture characteristics were similar between men and women, essentially indicating that we should be treating men and women similarly, and that we had excellent stent deployment and safety outcomes in both groups with no difference in stent expansion, and that this really supports that, the clinical safety and effectiveness of IVL for both men and women. Thank you.